Timeline of the 2019 to 2020 Wuhan coronavirus outbreak. This article documents the chronology and epidemiology of the novel coronavirus responsible for the 2019 to 2020 outbreak in Wuhan, China, and may not include all the contemporary major responses and measures. Furthermore, some developments may become known or fully understood only in retrospect. On December 8, 2019, the first patient was recorded by Chinese authorities to start showing symptoms. A later Chinese report finds an earlier case on December 1, pointing to an even earlier origin. On December 30, 2019, an urgent notice on the treatment of pneumonia of unknown cause was issued by the Medical Administration and Medical Administration of Wuhan Municipal Health Committee. 27 people with pneumonia of unknown cause were reported to the WHO on December 31. Most were stall holders from the Huanan seafood wholesale market, 7 of whom were in critical condition. The Wuhan Municipal Health Commission also made a public announcement regarding the situation. Hong Kong, Macau, and Taiwan immediately tightened their inbound screening processes as a result. On January 1, 2020, Hunan Seafood Wholesale Market, the source of the initial pneumonia cases, was closed on January 1, 2020 for cleaning and disinfection. On the same day, Chinese state news reported that Wuhan police interviewed 8 residents for spreading misinformation referring to the new infection as another SARS and exaggerating the danger. However, Channel News Asia reported on the same date that Wuhan police said they had punished 8 people for publishing or forwarding false information on the internet without verification. On January 2, 41 admitted hospital patients were identified as laboratory-confirmed 2019 nCoV infection in Wuhan. 27 patients had direct exposure to Hunan Seafood Wholesale Market. On January 3, Thailand began screening passengers arriving from Wuhan at 4 different airports. Singapore began screening passengers at Changi Airport on the same day. On January 5, early investigations into the cause of the pneumonia ruled out seasonal flu, SARS, MERS, and bird flu. The number of suspected cases reached 59 with 7 in a critical condition. All were quarantined and 163 contacts commenced monitoring. At this time, there were no reported cases of human-to-human transmission or presentations in healthcare workers. On January 6, Wuhan City Lianghui started. City representatives met until its closure on January 9. The U.S. Centers for Disease Control and Prevention, CDC, issued a travel watch at level 1 on January 6, with recommendations on washing hands and more specifically advising avoiding animals, animal markets, and contact with unwell people if traveling to Wuhan. On January 9, the WHO confirmed that a novel coronavirus had been isolated from one person who was hospitalized. On the same day, the European Centre for Disease Prevention and Control posted its first risk assessment. The WHO also reported that Chinese authorities had acted swiftly, identifying the novel coronavirus within weeks of the onset of the outbreak, with the total number of positively tested people being 41. The first death from the virus occurred in a 61-year-old man who was a regular customer at the market. He had several significant medical conditions, including chronic liver disease, and died from heart failure and pneumonia. The incident was reported in China by the Health Commission via Chinese state media on January 11. On January 10, the gene sequencing data of the isolated Wuhan coronavirus, a virus from the same family as the SARS coronavirus, was posted on virological.org by researchers from Fudan University, Shanghai. A further 3 sequences from the Chinese Center for Disease Control and Prevention, one from the Chinese Academy of Medical Sciences, and one from Jinyintan Hospital in Wuhan were posted to the Global Initiative on Sharing All Influenza Data portal. The same day, Public Health England issued its guidance. 11 to 12 January, in China, more than 700 close contacts of the 41 confirmed cases, including more than 400 healthcare workers, had been monitored, with no new cases reported in China since January 5. The WHO published initial guidance on travel advice, testing in the laboratory and medical investigation. On January 12, Hubei's provincial representatives from all over the province met in Wuhan until January 18. On January 13, the CDC announced that the genome had been posted on the NIH Genetic Sequence Database, GenBank. On the same day, Thailand witnessed the first confirmed case of 2019 nCoV, the first outside China. The affected 61-year-old Chinese woman, who is a resident of Wuhan, had not visited the Huanan seafood wholesale market, but was noted to have been to other markets. She had arrived in Bangkok on January 8. On January 14, 2 of the 41 confirmed cases in Wuhan were reported to include a married couple, raising the possibility of human-to-human transmission. A second death occurred in a 69-year-old man in China on January 15. The WHO published a protocol on diagnostic testing for 2019 nCoV, developed by a virology team from Cherite Hospital. On January 16, the WHO was alerted by Japan's Ministry of Health, Labor, and Welfare that a 30-year-old male Chinese national had tested positive to 2019 nCoV during a hospital stay between 10 and January 15. He had not visited the Huanan seafood wholesale market, but possibly had close contact with an affected person in Wuhan. On January 17, Thailand's second confirmed case was reported in a 74-year-old woman who arrived in Bangkok on a flight from Wuhan. The number of laboratory confirmed cases rose to 45 in China. On January 18, after the first 41 laboratory confirmed cases were identified on January 2, 2020, 16 days elapsed with no further confirmed cases before China reported 17 additional laboratory confirmed cases, with 3 cases in critical condition. The number of laboratory confirmed cases rose to 62 in China, with the ages ranging from 30 to 79, of which 19 were discharged and 8 remain critical. On the same day, the Wuhan government organized an annual banquet of 40,000 families. They shared meals and ate together. On January 19, the first confirmed cases were reported in China, outside Wuhan, 1 in the southern province of Guangdong and 2 in Beijing. Wuhan reported 136 additional laboratory confirmed cases, bringing the total number of laboratory confirmed cases in China to 201. A new death was also reported in Wuhan, bringing the total number of fatalities in China to 3. On January 20, Chinese Premier Li Keqiang has urged decisive and effective efforts to prevent and control the epidemic. First confirmed case reported in South Korea. Beijing and Guangdong reported an additional 3 and 13 laboratory confirmed cases, respectively. Shanghai confirms its first case, bringing the total number of laboratory confirmed cases in China to 218. The investigation team from China's National Health Commission confirmed that the coronavirus can be transmitted between humans. At least 2 people had become infected whilst living hundreds of miles from Wuhan. On January 21, the World Health Organization announced that it would hold an emergency meeting on the virus the following day to determine if the virus is a public health emergency of international concern. Confirmed cases were reported in several new locations in China. Zhejiang Province and Tianjin reported 5 and 2 laboratory confirmed cases, respectively. Guangdong reported 3 additional laboratory confirmed cases. Shanghai and Henan Province reported an additional 4 and 1 laboratory confirmed cases, respectively. 1 laboratory confirmed case was reported in Sichuan Province, and Chongqing reported 5 laboratory confirmed cases. Shandong, Hunan, and Yunnan all reported 1 laboratory confirmed case each. Jiangxi reported 2 laboratory confirmed cases. The total number of laboratory confirmed cases in China increased to 312 and the death toll increased to 6. 15 Wuhan medical staff infections were reported, of which 14 were from a suspected superspreader. New cases were also reported outside of mainland China. Taiwan reported its first laboratory confirmed case, and the United States reported its first laboratory confirmed case in the state of Washington, the first in North America. On January 22, Macau and Hong Kong reported their first laboratory confirmed cases, with Hong Kong reporting its second on the evening of January 22. Beijing reported an additional 5 laboratory confirmed cases, while Guangdong reported an additional 9 laboratory confirmed cases. Shanghai reported an additional 5 laboratory confirmed cases, while Tianjin reported an additional 2 laboratory confirmed cases. Zhejiang and Jiangxi reported an additional 5 and 1 laboratory confirmed cases, respectively. Internationally, 2 more laboratory confirmed cases were reported in Thailand, raising the total number of laboratory confirmed cases in Thailand to 4. North Korea closes its borders and bans foreign tourists over the nCoV. On January 23, Singapore reported its first laboratory confirmed case, a 66-year-old man from China. Scoot cancelled flights to Wuhan between 23 and January 26 over the virus outbreak, after a lockdown was imposed. Vietnam confirms its first 2 laboratory confirmed cases, a 66-year-old father and 28-year-old son from China. Wuhan suspended all public transportation from 10 a.m. onwards, including all bus, metro, and ferry lines. Additionally, all outbound trains and flights were halted. In Wuhan, construction began near midnight for a specialist emergency hospital, modeled after the Xiaotangshan Hospital during the 2003 SARS outbreak in Beijing, after it was proposed earlier in the afternoon. The new Huashenqian Hospital is expected to open by February 3 with a capacity of at least 1,000 beds. On January 24, the city of Jingzhou was quarantined, raising the number of people in quarantined cities to 35 million. The entire Hubei Province now came under a city-by-city quarantine, save for Shenangjia Forestry District. Japan, South Korea, and the United States all confirmed their second cases. Singapore confirmed its second and third cases. Thailand confirmed its 5th case. Hong Kong confirmed 3 additional cases, bringing the total number to 5. Nepal confirmed its first case, a student who returned from Wuhan. France reported its first 3 confirmed cases, the first occurrences in the EU. The French Health Minister Agnès Buzyn stated that it is likely other cases would arise in the country. The first confirmed incidence of human-to-human transmission outside of China was documented by the WHO in Vietnam. The Beijing and Shanghai governments have urged residents returning from coronavirus outbreak areas to stay at home for 14 days to prevent its spread. Following the 2 confirmed cases on January 23, Vietnam Aviation Authority sent a written directive requesting that all flights from and to Wuhan to be cancelled immediately and the tickets should be refunded. Exceptionally, the authority operates 4 special flights to carry Wuhan passengers home in the period 24-27th of January, and a backward flight to excavate Vietnamese citizens and diplomats. A study by Chinese researchers indicates that people can be symptom-free for several days while the coronavirus is incubating, increasing the risk of contagious infection without forewarning signs. On January 25, Australia confirmed its first 4 cases, 1 in Victoria and 3 in New South Wales. Malaysia reported its first 3 cases in Johor Bahru, and a 4th case later. Japan confirmed its 3rd case. Canada confirmed its first case in Toronto. Thailand added 2 new cases for a total of 7. Singapore confirmed their 4th case. A 62-year-old doctor reportedly died in the Hubei Province from the coronavirus. China's National Health Commission had sent 1,230 medical staff in 6 groups to Wuhan City, central China's Hubei Province, to combat the novel coronavirus outbreak in the region. As of January 25, 3 of the 6 groups began their work in the virus-hit area. Local media earlier reported that 450 military medical personnel have also landed in the city to offer support. Wuhan announced building a second emergency specialty hospital, named Liangshan Hospital, with a planned capacity of 1,300 beds, to be in use in half a month. The United States announces plans to evacuate U.S. citizens out of Wuhan by charter jet. The U.S. government later clarified that it only had limited capacity for private citizen evacuations. Beijing announced it will halt all interprovincial bus and train services starting January 26. Politburo of the Communist Party of China met to discuss novel coronavirus prevention and control. Xi Jinping, General Secretary of the CPC Central Committee, stated that the country is facing a grave situation as the number of infected people is accelerating. Hong Kong declares state of emergency. Hong Kong announced it would close schools until February 17. Hong Kong Disneyland and Ocean Park close until further notice. A Chinese and a Sri Lankan suspected with the infection were admitted to an hospital in Sri Lanka. On January 26, leading group on the prevention and control of the novel coronavirus outbreak was established, led by Chinese Premier Li Keqiang. The leading group has decided to extend Spring Festival holiday to contain coronavirus outbreak. The United States confirmed its 3rd, 4th, and 5th cases, 2 in California and 1 in Arizona. Macau confirmed 3 additional cases, bringing its total to 5. Hong Kong has confirmed its 6th, 7th, and 8th cases. Thailand has confirmed its 8th case. The first of 5 patients was already discharged. There are another 39 suspected cases awaiting confirmation. Hong Kong will ban anyone who has been to Hubei Province in the last 14 days from entering the city starting January 27. On January 27, Chinese Premier Li Keqiang visited Wuhan, epicenter of virus outbreak, to direct the epidemic prevention work. Mongolia closes border with China, shuts down schools until March 2, and calls for all public gatherings to be cancelled. International border gate centers of Haikou, Yunnan, China, Laos Cai, Vietnam, were suspended against Chinese tourists. The decision was declared by the head of Laos Cai Department of Culture, Sports, and Tourism, after an urgent notice from Yunnan Province's authorities. Singapore imposes a 14 days leave of absence for those working in schools, healthcare, and elder care who traveled to China in the last 14 days. Malaysia suspends all visa facilities for Chinese tourists from Hubei and its neighboring provinces in China. China's Finance Ministry and National Health Commission extended 60.33 billion yuan to help contain coronavirus. Wuhan suspends visa, passport services for Chinese citizens until January 30. Canada reported its first confirmed case and another presumptive case. Health officials have confirmed the 5th case of coronavirus in Australia, and have suspected an additional 5. The Sri Lankan Health Ministry confirms its first case of coronavirus, a 43-year-old Chinese woman. Cambodia confirms its first case of the virus, a Chinese man who came with his family to Sihanoukville. Singapore confirms a fifth case, a 56-year-old Chinese national who arrived from Wuhan on January 18. First confirmed case in Germany, a man in Bavaria had been confirmed to have coronavirus. 3 new suspected cases in Austria. Previous suspected cases tested negative. Ecuador reported a suspected case of coronavirus, a Chinese citizen who arrived from Hong Kong. Fiji authorities are holding 6 Chinese travelers in quarantine in Nadi as a precaution after they failed to gain entry to Samoa due to Samoa's quarantine requirements that were implemented Friday. Beijing reports first death from coronavirus. The mayor of Wuhan acknowledges criticism over his handling of the crisis, admitting that information was not released quickly enough. He said he would resign if it helped with public opinion, but pointed out the local government was obliged to seek permission before fully disclosing information about the virus, and that their response had since become tougher than others. On January 28, the Philippines suspends issuance of visa on arrival to Chinese nationals. The CDC stated it was boosting staffing at 20 U.S. airports that have quarantine facilities. Thailand confirms 6 more cases, bringing the total infected there to 14. Thailand starts scanning all travelers from China with immediate effect. Singapore confirms 2 more cases, bringing the total infected there to 7. Japan confirms 2 additional cases, bringing the total infected there to 6. This includes a man who has never visited Wuhan. He was working as a tour bus driver and had driven a group from Wuhan earlier in January.